Preventing sexually transmitted infections, STIs, involves adopting safe sexual practices and making informed choices to reduce the risk of transmission. Let's talk about the various strategies to prevent STIs. Abstinence. The most effective way to prevent STIs is to abstain from sexual activity. Mutual monogamy. Being in a monogamous relationship where both partners are faithful to each other can reduce the risk of STI transmission. Use of barrier methods. Condoms. Male and female condoms create a barrier that helps prevent the exchange of bodily fluids, reducing the risk of STI transmission. Correct and consistent use is crucial for effectiveness. Dental dams. Used as a barrier during oral sex to prevent the exchange of fluids. Regular STI testing. Regular screening for STIs is important, especially for individuals with multiple sexual partners or those engaging in high-risk behaviors. Early detection and treatment can prevent the progression of infections and reduce the risk of transmission. Vaccination. Vaccines are available for certain STIs, such as HPV, human papillomavirus. Vaccination is recommended for both males and females to prevent HPV-related cancers. Hepatitis B. Vaccination is available to protect against hepatitis B infection. Pre-exposure prophylaxis, PrEP. PrEP involves taking medication, usually through the to prevent HIV infection in individuals at high risk. It is essential to consult with a healthcare provider to determine if PrEP is appropriate. Post-exposure prophylaxis, PEP. PEP involves taking antiretroviral medications after potential exposure to HIV to prevent infection. PEP should be initiated as soon as possible after exposure, and it requires medical supervision. Communication and education. Open communication with sexual partners about sexual health is crucial. Educate yourself and your partners about STIs, transmission routes, and prevention strategies. Limiting sexual partners. Limiting the number of sexual partners can reduce the risk of exposure to STIs. Knowing the sexual history of partners and discussing STI testing before engaging in sexual activity can be beneficial. Avoiding risky behaviors. Avoid sharing needles or drug injection equipment, as this can increase the risk of bloodborne infections. Avoiding high-risk sexual behaviors, such as unprotected sex with unknown or multiple partners, reduces the risk of STI transmission. Regular health checkups. Regular checkups with healthcare providers allow for the monitoring of sexual health and can facilitate discussions about STI prevention and testing. Personal hygiene. Practicing good personal hygiene, including washing genital areas regularly, can contribute to overall sexual health. Treatment of infected partners. If a partner is diagnosed with an STI, it is essential for both partners to seek prompt treatment to prevent the spread of the infection. It's important to note that no method is 100% effective, and a combination of strategies is often recommended for comprehensive STI prevention. Individual circumstances, preferences, and health considerations should guide the choice of prevention methods. Regular communication with healthcare providers and staying informed about sexual health are key components of maintaining a healthy and responsible approach to sexual activity.